We turn our attention back to the 2025 World Health Day. In commemoration of this day, I'm joined by the PRO Association of Public Health Physicians of Nigeria, Dr. Lilian Ochai. Good to have you join us again. This year's theme, Don't Miss a Beat, is a powerful call to action, urging people to prioritize their health. What would you say are the leading causes of heart disease in Nigeria today?
Thank you very much for that. We know that major risk factors are due to unhealthy diets, physical inactivity, also tobacco use, excessive alcohol intake, and, also some other comorbidities like high blood pressure, diabetes, and things like that. So yes, these are what we would say are the main risk factors for cardiovascular disease.
Let's talk about what your association is doing to promote heart health, to also raise awareness and prevention at the grassroots level. What are the early signs to actually look out for as soon as you can, see them?
Yes, thank you very much for that. So yes, for cardiovascular diseases, signs that people could experience are chest pain. There could also be difficulty breathing. There could also be unexplainable tiredness, okay? And in some cases, swelling of the legs. So it could manifest in different ways depending on, what exactly is going on at the time. But these are some signs to look out for. So when you do notice these signs, it's very important that you seek help immediately as soon as possible.
Let's talk about preventive measures, not to get to that stage. How do you think individuals can take control of their heart health in terms of lifestyle changes? What would you recommend strongly for Nigerians at this time?
Yes, first will be eat a balanced diet. It's very important to ensure that you eat fruits, vegetables, because these go a long way in maintaining health. Another would be exercise. It's very important that WHO recommends 150 minutes in a week, so you could spread that out through 5 days. Ensure that you exercise regularly. Also avoid tobacco completely, so avoid smoking, and limit alcohol. So those are very key things to do. And also check blood pressure regularly. It's very important.
How much would you say the government really is playing in reducing the burden of the cardiovascular diseases in terms of policy changes? We have the health insurance, access to quick health care as soon as you see some of these symptoms.
So yes, the government is doing as much as they can. So there's still more that can be done, definitely, in terms of implementing these policies. But I do know that for instance, hypertension, which is one of the major risk factors for cardiovascular disease, it's important. It's usually done that whenever a patient comes to the clinic, it's one of the vital signs that are being checked for. And so if without symptoms or anything like that, we're able to tell the person's blood pressure and also be able to detect early enough what the person's blood pressure status is. So this is also one way that we are trying, and also we're trying to do more health education and taking opportunities of World Health Days like this to educate the masses and to let them know that prevention is better than cure, and also to make sure that they do these checks regularly and also maintain health by these physical activities and some of those other lifestyle changes that I mentioned earlier.
And this sort of, sums up my next question in terms of the potential of collaboration between healthcare professionals, the media like you're doing now, and civil society to help, educate Nigerians and raise awareness.
Sorry, come again.
Right, I'm talking to you about the potential of a collaboration between healthcare professionals like yourself, the media and civil society. How well do you think it will help in improving health outcomes in Nigeria?
Yes, it's going to help a lot because we also have there's this myth that people also feel like older people are the only ones that are mostly affected. But as we know that young people are also affected, it's also a good opportunity to utilize these platforms where we have a lot of young people, on them, and also just to spread awareness. Utilizing these mediums also help to just spread the word and get more people to know that, okay, this is how you can improve your overall health. So yes, it really does go a long way.
Dr. Lillian, thank you for educating us on the World Heart Day.